Hello. Just need to unmute yourself, Lee. We've got you covered there.
Okay. Can you hear me now?
Hi. How are you?
I'm great. How are you doing?
I'm very well, thank you. Thanks so much for carving out a chunk of time. I know it's a busy, well, it's just busy, isn't it, at the moment, which is kind of cool, but there we go.
Yeah. All the things, right?
Yeah, absolutely. So I know your time is short today, but I've just got 3 questions for you, really, if that's okay. We'll dive straight in. So you're going to be at Wellbeing Fest, and we'd like to know why you think that an event like Wellbeing Fest is so important right now.
Yes, absolutely. I think coming together in person has never been more important, to be near other people who are critically thinking about their path forward, about the health of their family, and about the welfare of their community as a whole. So I think coming together there's never been a greater time. And talking about healthcare, alternative ways to pursue wellness, how to care for our children, has also never been more important, because there's this epic push and tidal wave of one size fits all mandatory medicine coming through our world, sweeping the whole globe. And for us as individuals to live empowered to make health decisions for ourselves and for our families has never been more important. So I'm excited to be with people from our community, from all different walks of life, and explore ways that we can step forward and support each other.
Yeah, it's really exciting to actually be in person. I must admit, I'm looking forward to it too. So tell me a little bit about you and your organization, and how you kind of got it started, and what the objective of it all is. I know it's something you're very passionate about, so can we kind of unpack that a little bit?
Yes, I practiced law for a handful of years, mostly antitrust cases, bet the company litigation. I was on large litigation teams and left all that behind about 3 years ago, because I had originally even stepped foot into law because of my passion for foster care. And in 2018, we were just moments from taking our next foster placement, and we're told that we're no longer eligible to be foster parents because Isaiah and Samuel, my biological sons, do not receive all 69 doses of Indiana state mandated vaccinations. And at that point in time, I said, okay, well, show me what has changed since my last placement. And why are we now all of a sudden in danger? What science do you have to show this? What new law, what regulation? Of course, there is nothing except for a talking point that says your kids are dangerous to others. And I thought, it really is not okay with me that policies that don't have any backing are getting in the way of our most vulnerable children being placed in a law-abiding, loving home. And I knew that those policies would continue to affect all of us, not just our foster children, as long as enough of our community doesn't know the truth and live empowered to make choices according to that truth. So I said, okay, God, where do we go from here? And I started reporting through greenmedinfo.com on the government's response to the measles outbreak at that time. And we noticed that the people they didn't have the tools to act, for us to show the diversity of the population that cares about health freedom, that cares about parental rights trumping the state's desires for our children, and that cares about religious freedom and bodily autonomy. So we set out to get the tools into the people's hands to use their voice, to exercise their voice, and to become empowered to live freely in this manner. So we started from ground zero, and now we're at 400,000 advocates nationwide. Here in the state of Indiana, we have over 16,000 advocates taking action on standforhealthfreedom.com, contacting people when they need to mobilize for policies that expand health freedom or to oppose policies that would chunk away health freedom. So our goal is to empower the people, to take them from aware to activated, and that they have the courage and the knowledge to live freely as it relates to the care of their own bodies.
And then COVID hit in 2020. And you were
Right.
already advocating
We
at
were
that
here
point.
ready. Right. And I think because of we all knew that the push for mandatory medicine would eventually come to something of this effect, when responding to an infectious disease. The World Health Organization has put out documents for years with this vaccine consortium that they have that always has the vaccination plan for the next 10 years. And the last two the goal has been to leave no one behind, to identify any pocket of vaccine hesitancy and snuff it out. So we knew that the adult mandates were coming. We knew that there would be a lot of pressure to comply with the pharmaceutical lifestyle. And here we are today, and people need these tools now more than ever. And so it's an honor and it's humbling to be in this position, helping people who now recognize that this issue is in their backyard.
And what are you actually going to be doing at Wellbeing Fest? What have you got in store for people that come to the event?
Well, it'll be important to talk about local stuff, locally, what's going on, locally, what can we do? Where can we connect? What's the information that we can get a hold of? So I think dialing into the Indiana level, the Indianapolis level resources will be key. And then talking about how we can step forward in 2022. I know we're not there yet and we still need to be present in this moment, but there are changes that could come on the horizon that would open up our society to be unified more freely. And I want to talk about a project that we have that could help with that effort.
Oh, fantastic. And you're actually going to be on one of the panels, aren't you, talking about this very issue?
I will be. I'll be on a panel. So we'll be there available to answer questions and discuss whatever y'all have for us.
Well, thank you so much for your time today. That's been really helpful. I'm looking forward to meeting you in person and seeing everybody at Wellbeing Fest that's going to be there. It's going to be an exciting time to be in person.
Yes, thank you, Tina. It'll be great.
Thank you.